Jesus Christ. My name is Dr. Ominde. We finalized the lecture on the retroperitoneum. So we have retroperitoneal nerves. So which nerves are found in the retroperitoneum? You have the sympathetic trunk, hypogastric plexus, and nerves such as the T12 nerve, which is a subcostal nerve, L1 nerve from L1 segment of the spinal cord. So we have iliohypogastric and ilioinguinal. Then we have genitofemoral nerve. This nerve usually lies on top of psoas major muscle. There's lateral femoral cutaneous nerve. There's femoral nerve that lies on the lateral to psoas major and obturator that is medial to psoas major. So on top of psoas major is genitofemoral. Lateral to psoas major is femoral nerve, and medial to psoas major is the obturator. So all these are nerves in the retroperitoneum, and from L1 genitofemoral, lateral, cutaneous, these are from the lumbar plexus of nerves. So you can see here, you have the different nerves. This is your sympathetic chain. This is L1 giving you iliohypogastric and ilioinguinal nerve. Look at the subcostal just below the ribs, below the diaphragm there. The ones directly anterior to the psoas major, this is psoas major, this is your genitofemoral nerve. Medial to psoas major is your obturator nerve, and lateral to psoas major it should be your femoral nerve, and this is the lateral cutaneous nerve of thigh. Okay. Again, the sympathetic trunk, then the L1 will give you iliohypogastric and ilioinguinal. This is your genitofemoral nerve, okay, lateral cutaneous nerve. This is femoral nerve and obturator nerve that is usually medial to psoas major. This is your psoas major muscle. Obturator here, femoral is lateral to psoas, anterior to psoas is genitofemoral. Then you have subcostal up here, just around the rib. And then L1 gives you iliohypogastric and ilioinguinal that pass anterior to quadratus lumborum. Then lateral cutaneous nerve passes anterior to iliacus, and you see it posterior to the inguinal ligament, just at the level of the anterior superior. Its attachment, inguinal ligament attachment at anterior superior iliac spine. So you have L1 to L5, the lumbar part of the lumbosacral plexus, where L1 gives you iliohypogastric and ilioinguinal. These are anterior to quadratus lumborum muscle. Then L1, L2 gives you genitofemoral nerve anterior to the psoas major. L2, L3 gives you lateral cutaneous nerve, which is anterior to iliacus and posterior to the origin of inguinal ligament at the ascis. We have femoral nerve and obturator nerves. They are root value L2 to L4. Femoral passes lateral to psoas major, while obturator nerve passes medial to psoas major. Then L4 to L5, you find the lumbosacral trunk now joins the sacral nerve to form sacral plexus. So that's where you have, we call it lumbosacral because L4, L5 join the sacral nerves. So this we have already gone through. So you identify your psoas, anterior to it, genitofemoral, lateral to it, femoral, medial to it is your obturator nerve. This is your sympathetic chain. Okay, this is your subcostal nerve just below the rib. This is quadratus lumborum, so this is iliohypogastric and ilioinguinal. This is your iliacus, so this is femoral cutaneous nerve, and we said you find it posterior to attachment of inguinal ligament at the ascis. This is your femoral nerve here. So posterior abdominal wall basically has vertebra, has muscles, psoas, quadratus lumborum, iliacus. It has a diaphragm. You have fascia, so there's thoracolumbar fascia and fascia covering psoas muscle. Then you have lumbosacral plexus. We have neurovascular structures like the aorta, inferior vena cava, there's lymph nodes and fat. So basically, the whole lecture on retroperitoneum has discussed these structures extensively, and there's a separate lecture on the thoracic diaphragm. So these are the muscles of the posterior abdominal wall. There is the diaphragm, quadratus lumborum, psoas major, iliacus, and psoas minor. They're supplied by lumbar arteries and iliolumbar arteries, except the diaphragm. There's a whole lecture video on the diaphragm, so you look for it and get all the details about the diaphragm. Then these are the muscles on the posterior abdominal wall, which you need to understand their actions, innervations, origins, and insertions. So you take time and look at this table for these muscles, learn their origins and insertions, use your atlas to look at the origins and insertions, learn their innervations, learn their actions and the blood supply and where all these arteries come from. For example, iliolumbar comes from internal iliac. The lumbar arteries come directly from the abdominal aorta. So those are the things you need to know the details. Root value of femoral nerve is L2 to L4. Psoas major is innervated by femoral nerve. Then I've said there's a whole lecture on the diaphragm, so you need to just go know the parts, the sternal part of the diaphragm, the lumbar part, the costal part. Then there's a central tendon. Innervation, there's different motor and sensory innervation of the diaphragm. Motor is mainly biphrenic, sensory is biphrenic, but there's intercostal nerves that innervate the peripheral muscular part of the diaphragm. And diaphragm, remember, is the chief muscle of respiration, and it receives blood supply based on the surface. So the superior surface gets blood supply from terminal branches of the internal mammary from first part of subclavian, and these terminal branches are pericardiophrenik and musculophrenic. Then the inferior surface of the diaphragm is mainly supplied by the inferior phrenic arteries, which are direct paired branches or lateral branches from the abdominal aorta. So you need to pause and assimilate what is on this table. So thank you very much, and that is the final lecture on the retroperitoneum and its structures and organs. Thank you very much.